Good morning. I am an assistant of the Department of Traumatology and Orthopedics, J.A.Rizayev. Today's topic is the complete orthopedics examination of patients with injuries and diseases of the locomotor system. Complaints of orthopedic patients: the pain, the limb length discrepancy, restriction of the movement of the joints, swelling, the defects of the soft tissue, the losses of functions. Anamnesis. First of all, case history. In case of the orthopedic injury, you must determine exact date and time when the accident has happened. The determination of the circumstance and the mechanisms of the injury are very important in making the correct diagnosis. In making the history of the trauma patient who may have a fracture, the following points may prove to be helpful, especially when there has been a traumatic incident. Second, life history, family history. History taking is not just a way of killing time before writing up an X-ray form. It makes the diagnosis more often than does examination or X-ray alone. A complete history would be very boring, but it is important to include the development and family histories. There is passive postural position. There is also postural position. Clinical measurements on the body, the normal axis of the spine, non-symmetric triangle of the waist. Clinical measurements of the body, first of all, scoliosis and the second, kyphosis. Coilosternia. Clinical measurements of the upper limbs, axis of the upper limbs, valgus and varus. Clinical measurements of the lower limbs, axis of the lower limb, valgus and varus. Valgus of the limb, of the tibia. Clinical measurements of the lower limbs, valgus of the knee joints. There are 3 degrees of joint stiffness. Ankylosis, all types of the movements are absent. Contracture, there is visible limitation of the movements. Rigidity, the range of the movements in the joint is less than 5 degrees. The flexion contracture of the knee joints. Clinical examination of the range of movements in humeral joints. Clinical examination of the range of movements in elbow joints. Clinical examination of the range of movements in coxofemoral joints. Range of the movements in the coxofemoral joints. Clinical measurements of the body, the comparative measurements from the bones puncts. Clinical measurements of the upper limbs according to the bone puncts. Clinical measurements of the lower limbs according to the bone puncts. The comparative measurements from the bones puncts. Types of the limb length discrepancy, LLD. First of all, real anatomic LLD may occur due to the fracture or congenital anomalies, for example, bone dysplasia, hemihypertrophy, etc. In these cases, one leg or arm grows faster than the other. Second one, apparent LLD, is due to the telescoping of the hip or humerus resulting from dislocation. Third one, positional LLD, is due to an adduction contracture or fixed flexion at the knee or hip. In these cases, the limb is shortened. The abduction contracture can make the limb surprisingly longer. And fourth one, mixed LLD, is the total sum of all before mentioned types of LLD. That's all. Thank you very much.